Guys, how are you doing? Hey, how are you doing? This is the Queen, Terry Battle here. I have about 5 minutes today. Okay, so I'm going to be really briefly quick. Again, this is the Queen Terry Battle. I'm coming here from the capital of New York in Albany, New York, and I'm thankful for this hotel letting me and the library for letting me use their facilities as well as pretty much giving you guys a status update about what's going on. I am. Trying to get this camera. There we go. Okay, so pretty much I am doing research right now on the coronavirus as well as through the World Health Organization and the National Institutes of Health. I'm also doing some in the process of doing another community talk, another fireside chat with the New York Public Library outside of New York, either in the Bronx or Queens. Again, another community talk in about a couple of weeks, maybe early April, in response to talking about what is the medical community doing about the coronavirus epidemic and the lack of local neighborhood community response to this pandemic worldwide epidemic outbreak. So I'm going to make this really quick. I'm thankful for this facility for letting me use the resources and the Wi-Fi and the computer. So thankful for that. Pretty much, I'm currently, I've been on LinkedIn, I've been on Facebook pretty much, as well as here in Albany, getting my name out there on the streets, begging for change, as well as for protesting. I started protesting against healthcare policies and a lot of issues that are going on here in the medical community. And I feel that there's a lot of issues um, with the lack of the top heads in this response. There's a lot of top head officials talking about the coronavirus instead of local community doctors actually talking about what the symptoms of this disease is and how the local cities and the local communities can deal with this epidemic. So usually the epidemic, it doesn't start worldwide, it starts in little bitty pockets of China or little bitty pockets of India or Europe or South America, and then it goes into little bitty pockets and then it spreads like an epidemic and then into a pandemic. So a pandemic and then to an epidemic. So I did protest that it's not just my job, it's actually the medical community's job, it's the local hospitals, it's the local physicians and the nurses, because people when they go to work, they think, okay, I'm here to make my 50, 60, 70, $80,000 a year. But at the same time, this is an epidemic. This is a global health crisis, and the neighborhoods, the local cities need a general response from a personal response from local doctors, neighborhood doctors, community doctors, street doctors, neighborhood physicians, family nurses to actually let them know instead of closing down schools, we can actually have down nurses on site, nurses on have nurse facilities, pop-up nurse facilities in the schools to actually test every single student and make sure that this virus is contained, because right now it's going out of control. So it's so much out of control, especially Harvard University, Penn State, all these Big Ten colleges are actually closing down for the whole entire spring semester in response to this rage of the coronavirus. And I've seen the pictures of people with this illness. I've seen the pictures. They're having respiratory distress. They're on ventilators. The whole medical staff, the physicians, the technicians, the nurses, and the doctors are covered fully clothed and from heads, from arms, and from completely clothed and medical PPE, which is personal protective equipment, in order to protect them from any kind of droplets, um, uh, any kind of human droplets from this disease. So I do completely understand the epidemic. I've seen the pictures. You can just Google. You can just pretty much Google coronavirus epidemic, coronavirus patient pictures, or patient exposure to coronavirus. Just Google coronavirus visual pictures, and you'll see actually people covered, having problems breathing. Their respiratory symptoms are completely shot. There are ventilators at least about 6 feet long, and the doctors are actually pulling out tubes Doctors are putting in tubes and tubes and tubes to feed down their throat, their esophagus, in order to get these people to cough up or whatever it is inside their immune system, because that's how this disease spreads. It spreads and gets into your visual, your sensory, your senses right here, your nose or your mouth or your eyes, and then it goes into your whole virus system, and it causes a respiratory attack on your immune system, where pretty much you can't breathe, you can't think, and just causes pretty much distress, shock, complete shock on your system. So you actually need somebody to go in there, take a big, long tube, any kind of incision bite to actually go into your thorax, your esophagus, go all the way down into your system and break that out and actually feed your system the nutrients. Because this coronavirus, it actually causes a shock upon your system. So people don't understand and think, oh my God, oh, it's a virus, oh, it's epidemic, pandemic, it's spreading. Yes, it is. There is an issue about it. Yes, it's spreading. Yes, there needs to be infection control cautions. Yes, we need to sanitize our hands. Yes, we need to clean our facilities. Yes, we need to clean our surfaces. Yes, we need to wash our hands, clean our bathrooms. Completely understand that. But the primary issue is getting the local family physicians, the local family doctors, the local community doctors out there to actually let the cities know, let the schools know, let the hospitals know what exactly is this issue. Instead of the top heads talking about the issue, instead of the president of the World Health Organization talking about the issue, instead of Donald Trump talking about the issue, instead of all these top heads talking about the issue, we actually need local doctors to go into the community. We need the local family doctors. We need the internists. We need the gerontology doctors actually go into the community, go into the schools, go into the churches, and actually speak to the local communities, actually speak to the schools, actually speak to the legislators, and let them know, okay, this is happening in our community, this is happening in our city, this is happening in our state. Here is our local response to this epidemic. Now, usually when an epidemic happens, there's different symptoms on the virus. There's different symptoms everywhere around the world. So one symptom in China is the one strain in China is completely different from another strain in the United States, and another strain is different in India than another strain it is in the islands. So there has to be specific doctors in each region of the world to respond to the different symptoms that are dealing with this virus. Now, when you do research on the coronavirus, it has nothing to do with drinking Corona beer. It has nothing to do with, hate against Mexicans or Asians or whatever like that. It's actually, if you do the research behind the word corona is actually a combination of illnesses. It's a combination of viruses. All viruses, it's like a corona, it's like a tunnel, it's like a volcano. So that's why they named it the coronavirus, because it's like a volcano of illnesses coming around. It's a corona, a volcano, a tunnel. It's a whole tunnel. It's a tornado of illnesses coming together. Some of the illnesses resemble SARS. Another one of the illnesses resemble, swine flu. So it's a whole tunnel, a whole tornado of illnesses coming together from just all these old viruses coming together and building up into one huge virus. So you have SARS, and then you have the swine flu. So you have SARS coming in together, and you have the swine flu coming in together, and all of these viruses actually coming together and forming one new virus together. And that's why they call it a corona, because it's a combination of all these old viruses that we thought that we had vaccines for, but in reality, these are all these old viruses that we had to deal with, especially Ebola. They actually think Ebola might be in this coronavirus too as well. So all these viruses are coming together, and they're actually becoming a super virus. And that's why they call it a super tunnel virus. And so this super tunnel virus is something that the World Health Organization and the CDC and the NIH are not able to actually visualize what what kind of virus vaccine can we do? What kind of medicine can we do? Because it's impossible, because this combination of viruses, big super virus, is actually affecting so many people so fast. And it's spreading from China, and then it's impacting the United States, going from east to west just like that. So it's really, really hard to do, because that's why I say that we need a local community response in regards to this epidemic, or regards to this pandemic of this coronavirus. So I'm continually doing research. I'm going to actually do a couple more talks in a couple of weeks. Hopefully the story will be the same, but it's going to be spring. It's going to turn to summer. So even though the weather may get warmer, even though the weather may be cooler and warmer, or a bit more humid, that still, it may cause a lot of the viruses, the stats to go down, but the virus is still in the air. Don't let weather fool you into thinking that it does no longer exist, because in reality, that virus still may be dormant, but it can build up in different ways. It can change like that. So don't let weather fool you into thinking that this virus is over, because just because you go from the north into Florida, or you leave New York, or you leave Jersey, and you go to Florida, you think you may be okay, but in reality, when you go to Florida, there may be something even completely worse. And usually when people go from north to south, they have to deal with mosquitoes, they have to deal with bugs, they have to deal with that islands, that island water, that island air, that ocean water, and all the other illnesses that like the local people also deal with. And a lot of Americans, when they visit, they go overseas, or they go into different countries, or they even go to the Caribbean. The Caribbean people have a barrier. They have their own immune system against their local diseases. So when Americans go to different islands, their immune system is different from the local people's immune system. That's why the CDC and the NIH have actually provided years and years ago for Americans to have their vaccines up to date when they travel. So it's very important to have Americans, as well as children and adults, to have your vaccines up to date, because this new virus, this coronavirus, is something that it's very old. I mean, I've heard that it's actually been about 20 years old, but it didn't start in this year in January. It actually started early 2018 and early 2019. But the big media vice did actually get up into play. Didn't have the media buzz didn't start until December, January of this year in 2020. So the media buzz is big right now in February, March. But in reality, this disease has been out in the public for at least over 2 years now, and even older, but they're actually talking about it now. So I just want to get out. I'm going to be doing some more community talks, and about maybe mid-April, maybe late March. I'm in talks right now of doing scheduling a community talk in the Bronx, because right now New York State has been affected by this coronavirus. There's a couple of cities here. Let me see. I spoke to somebody today, one of the local churches, about doing a community talk. Let me see. There's actually a city in New York State, in northeastern New York State. It's called New Rochelle, and New Rochelle, New York, is really about 20 minutes outside of the Bronx, and about maybe an hour away from Queens. And just imagine a viral infection spreading from, even though it's a suburb of the Bronx, it can get into the Bronx, and then it gets into the city like that. And you already know that New York State is already building up containment zones around the bus stations, the bus terminals, in the subways. So pretty much it's the beginning of March, but it's getting to be a little bit out of control. And I do say that it's getting out of control because there is no response from the medical community about this. You have top heads talking about this. You have news reporters talking about this. You have the media talking about this, but there is no local physician, local nurses, local churches church pastors out there, rabbis, ministers, pastors, preach, fathers, there is no local response to this epidemic. And when there's not a local response, then the community as a whole, Black, white, um, uh, Protestant, Catholic, they don't know how to respond to this. And usually when I went to church this past Sunday, the father, they disposed of all the holy water. So I was not actually able to bless myself with the holy water. So they took out all the holy water from the church, and all the uh, the communion bowls. They only serve crackers. They didn't serve wine. So even as a Catholic church, as a parish in a Catholic church, they're still responding to that as well. So I am really protesting, as well as out there in the community. I'm be talking to my legislators as well, if I can get access to them, because it's another issue as well, getting access to them in response to this, because there is no local communication with this coronavirus. There's no churches talking about it, pastors, preachers on TV talking about it, local physicians, local community doctors, local clinics actually out there talking about what can our city do about this. It's on the streets, it's in the media, but it's affecting our streets. So instead of closing down schools, we can actually, instead of closing down university campuses, we can actually send out nurses and send out doctors and send out technicians on site to actually help all 5,000, 10,000, 20,000, 30,000 students, test every single one and set up a pop-out clinic on site and test these students, instead of having 50,000 students miss a whole entire semester of university school and lose their tuition money because of this epidemic. And this is not the first time it's happened. There have been many epidemics in the past, but the United States and the local global health community have been able to respond to that. But right now in 2020, we have to know, even as the millennial, how to respond to a global crisis as a whole. So right now, all we're hearing about is from the top heads, Trump, the president of the World Health Organization, the presidents of the hospital. We're hearing from the mayor of New York, Bill Bilasio. We're hearing from Governor Andrew Cuomo, but we're not hearing from our hospital heads. We're not hearing from the presidents of our local hospitals. We're not hearing from the doctors, the clinic directors. We're not hearing from the physician in charge at our local community hospitals. And when we're not hearing from local community, we're hearing from top heads instead of local community, then that's a problem. Because usually when top heads have control of an issue instead of the local people, usually they're the ones making decisions for us instead of us making decisions for ourselves. So usually when a top head makes a decision, they make a general decision for everybody, but everybody's case is different. And so that's why we need our local people to respond to this epidemic in the local ways that it affects each and every single community. Because the coronavirus affects every community in a different way, especially when it gets to New York, because it might affect Queens in a different way, it might affect Brooklyn in a different way, and it might affect Staten Island and Manhattan in a different way, as well as in California, because the weather is different. And so when you deal with viral illnesses, even the weather climate, the climate or the weather or the humidity in a region affects a viral infection differently. So somebody in California might have few symptoms to a viral infection, and somebody in Arizona might have different symptoms, or somebody in Seattle, or somebody in Montana, or somebody in Colorado, or even somebody in Atlanta or New Orleans might have different symptoms to this combination of illnesses. So it has to be on a local view, a local talk about it. Instead of having the top heads talk about it, we actually need our local clinics, our presidents of the hospitals, our physicians in charge, our nurses in charge, our local pastors and our local community figureheads to actually talk about this illness on a local neighborhood approach, instead of letting the top heads talk about it. Because when top heads make decisions, they make decisions for everybody. And when a top head makes a decision, it affects everybody, whether they say yes to it or no, or whether they like it or not. So a lot of people can be affected by a top head making a decision. And when a top head makes a decision, usually it's very generic, and it might not apply to everybody's situation. So that's why I'm agreeing to this being actually on a local approach, having our local neighborhood hospitals, our local neighborhood clinics, and our local clinics in the neighborhood free clinics, as well as private clinics, as well as our church and parishes, our local community gatherings, are wherever we meet for a community to actually talk about this virus on a neighborhood level. We don't want it to get too out of control where we're closing down elementary schools, or we're closing down high schools, where we're closing down schools, or we're closing down libraries, or we're closing down churches, where the churches, the members of the congregation are not being served because of this virus, which is getting way out of control. And so you're closing down an entire semester of school for 6 months, and the virus might be over, the symptoms and it might be over, it might run its course in less than 6 weeks. And in less than 6 weeks, the virus might be run its course. And so a whole entire population of students may have lost at least $30,000 because it's a media frenzy. It's gotten out of control, and there's not actually a neighborhood response to this illness. For the neighborhood physicians, especially when you're at Harvard University, it's Boston. And so there's plenty of hospitals in the Boston area to respond to this on a neighborhood level. In Penn State, there's plenty of doctors in Pennsylvania to respond to this illness in a low neighborhood. And UCLA, there's plenty of doctors in Los Angeles to respond to the way that this coronavirus affects the students and the community as a whole. And so you have to think about it on a neighborhood level instead of letting somebody talk you out, letting a talkhead or a figurehead talk about you and waste your time and energy and effort and your life staying in the house all day, when you can actually go down to your neighborhood doctor, go down to your neighborhood clinic, and actually ask your neighborhood doctor what's going on, what are the symptoms I need to look for, how can I continue on with my life, instead of staying in the house for 6 weeks when you don't show any symptoms of the illness at all. So your neighborhood, your community is segregated. Your neighborhood community is pretty much in containment zone, and nobody in your community shows any kind of symptoms of the illness at all, because a figurehead, a talkhead, is talking over your community instead of a local doctor or a local clinician or a pharmacist or a local nurse actually making decisions for the community as a whole, instead of a talkhead making decisions for everybody. So I do understand that the National Guard does need to be out there in New Rochelle. I completely understand that, Governor Cuomo. I completely understand that, President Trump. I completely understand that. But there needs to be somebody from the local community in New Rochelle, New York, as well as in the Bronx, New York, to actually speak for the community as a whole, to actually go out to the houses, go out to the people of the community, figure out what is the community symptoms, and deal with that on a particular level, instead of letting somebody in charge over a billion people population talk them out. So people are in a containment zone for 6 weeks, for 3 months. They're on a ship for 6 months. And this illness, people are boarded on a ship for 6 months with little water, with little food, and barely surviving, and unable to even, go to the restroom or whatever. They're on a ship for 6 months. But a talkhead is making decisions for this whole crew, and all these people, 5,000 people on a cruise ship, and actually nobody in the cruise ship. There's plenty of doctors, there's plenty of nurses on the cruise ship that didn't actually say, okay, some people on this cruise ship have particular symptoms in response to the virus, but the rest of the people on the cruise ship don't have any symptoms of the virus. So we can contain the people, let them leave the cruise ship, test them, either through a swab or a skin exam, and let them leave in peace. And the rest of the people that have any kind of symptoms in response to this on a cruise ship, please put them in containment, but take them off the ship and let them live their lives. Put them into a hospital, put them into a facility, so that we can know what are the symptoms of the illness. How did this affect our particular community, even on a cruise ship, and how did we respond to this, preventing this from spreading further from NC and actually going onto land. So, and then animals is an issue. Of course, viruses come from animals to humans. That's normal. But you can't blame a dog, you can't blame a pet for causing a worldwide epidemic all of a sudden. You can't blame, it came from animals to humans. I mean, That's ridiculous. It had to come from some way. And there are issues of, cleanliness in Asian markets, especially Asian wet markets. I completely understand that Asians, and especially a lot of Middle Eastern people and people from the East, they eat completely different from people in the West. So I do completely understand that, because it's not sanitary to eat a lot of street food in Asia. Completely understand that. But again, you have those particular symptoms. The people that live in the East in Asia have a different immune system than the people that live in the West, whether in Europe, London, and the United States. So again, you have to put it in a local level, because this epidemic may affect the billions of people in China in a different way. So there needs to be Chinese doctors that respond to the epidemic. There needs to be Indian doctors that respond to the epidemic. Chinese nurses, Chinese technicians, Chinese pharmacists, to have a Chinese vaccine for this epidemic. But you can't use a Chinese vaccine for an American vaccine. It's not going to work that way. So it needs to be on a local site, a local network, where our community hospitals, even student-run hospitals, where they under the direction of a clinician in charge, a doctor in charge, a local resident physician in charge of the staff. So even student doctors, med school students, they still need to actually go out to the community. Even medical school students, nursing students need to actually set up as a group and let the community know that this needs to be on a neighborhood approach, a local level, instead of letting this illness, this epidemic, this pandemic get out of control. So it is getting out of control, closing down schools, closing down libraries, closing down facilities. But people are still going out to the grocery store and going shopping for food. So if it's affecting schools, why is it not affecting our food supply? See how that's out of character? So the USDA hasn't said anything about that at all, how this coronavirus is affecting our food supply either. That's completely different. They even haven't talked about that. But usually if something comes from overseas to the United States, the first thing it's going to affect is the United States food supply. Believe me. And if they haven't talked about it, they're going to be talking about it pretty soon, because you can't have a virus from the East going to the West and not affect the food supply, especially the meat supply. So please, guys, be concerned about that as well. So I'm sure Trump has talked about not getting exports or imports from China or whatever like that. But again, we have to put this on a local community level. And I'm only a medical assistant, a certified medical assistant through NCCT. I'm a first aid responder. I'm out there in the community. I'm being there for people in emergencies as needed. I'm crazy when I go to hospitals. I'm always just, okay, I'm here as a patient, but I know some things are out of character for the staff as well as for the doctor. So something's going on. So in response to Bill Bilasio, in response to Governor Andrew Cuomo, in response to Commander-in-Chief Trump, in response to the National Institute of Health and the CDC and the WHO, the World Health Organization president, we actually need to take this out of character, out of the top heads, and actually need to bring it down to a local community level, because if you have the top heads talking about a global epidemic instead of the local people talking about a global epidemic, it's going to get out of control real fast. And so there's going to be different symptoms of the disease, but the top heads only think of one disease. When they're talking about this top heads, the president of this, the president of that, the director of this, the director of that, the prime minister, the congressmen, the senators, they only think of one thing. They don't think, okay, we got a virus, we need to solve it, we need to destroy it, and we need to make a vaccine. That's it. We need to make a medicine. We got a virus, we need to make a medicine. We got top decisions. But they're actually not thinking about the community, because it's a different level. You have the top head, like I talked about last night, talk about my mental illness issues and going to the community and being barred from this and barred from that, and ADHD and autism, whatever. But even in the mental health community, this is also affecting the mental health community as a whole as well, because it puts more stress on people. It puts more depression on people, because they're not able to work. They're not able to go outside and function. They're being stuck and excluded into their homes for 5 to 6 weeks with no fresh air, no fresh food. They're being excluded in their homes and not able to function well in society because they all of a sudden show illness of a viral infection. So that causes stress, that causes anxiety, that causes depression, that causes more extreme cases of mental illness. And the weather is changing. It's become sunnier outside. It's becoming warmer, and people are staying inside their homes, and the weather's changing. So it's getting warmer, the weather's getting better, and people are actually being included into their homes by the government. So we can't go outside and enjoy the weather. We actually have to be enclosed in our homes because of this viral infection. So it's causing depression, it's causing anxiety, it's causing stress, it's causing a lot of mental illnesses that the mental health community has to deal with as a whole. So there's a lot of issues that deal with this. But again, to Commander Chief Trump, Governor Andrew Cuomo, even Vice President Mike Pence, in response to this virus, it has to please bring this down onto a local community task force. I do understand the president, he has a task force for this coronavirus, but it actually needs to be on a local community approach. Because when you're closing down school campuses and universities campuses of over 50,000 students have to lose a whole entire 6 months of coursework because of a viral infection. So you have 60,000 students that are wasting away half of their tuition money and going to class, and especially with science students, they actually have to go to class and go to lecture and lab in order to get credit for the courses. You can't learn everything online. So a lot of science students, a lot of medical students, a lot of nursing students, they're losing their valuable time and their valuable energy in their studies. They're losing their time, they're losing their school education in regards to this illness. So it has to be done on a more local community approach. So a local community task force, community hospitals, neighborhood hospitals, parishes, pastors, churches, mosques. It needs to let the community know as a whole, the local community, the streets, the parishes, the suburbs, the all the, I can't even think, I'm still learning New York City. The boroughs, all the boroughs in New York, they have to divide up and let the streets on the communities in a different whole. It'll affect every borough in a different way. So one borough might have a different symptom of the illness than another borough. So it has to be done on a neighborhood approach because we don't want a figurehead, a talkhead making decisions for us as a community instead of letting the community make decisions as a whole. All right, so I'm 30 minutes into my YouTube video. This one was a really good one last night. Last night I made a little blurb, a blog, talking my head off, being very emotional. So I do apologize for that, guys. I really do apologize for being really emotional last night. But I gotta let you guys know what I'm going through. So I'm still broke, but hey, it's New York. I got a phone. I got friends. I got people to talk to. So please continue to keep me in your thoughts and prayers. I'm pretty much going to set up a GoFundMe site. I'm out here. My friend is calling me right now. Somebody's calling me. Somebody's calling me right now. So, guys, please continue to keep me in your thoughts and your prayers. I love you. Thank you for YouTube community for letting me be able to express myself through this platform. Thank you for Facebook being able to let me express myself on this platform. And again, one more time. It's beginning to the mid of March. We need to let the top heads stop talking about this virus and let the local community, pastors and priests and fathers and rabbis talk about how this illness is actually affecting their neighborhoods, their boroughs, their local cities, their local parishes on an individual level. Because it's a coronavirus for a reason. It's a corona. That means it's a combination. That means it's a tunnel. That means it's a tornado virus for a reason. So this tornado virus, this tunnel virus is going to affect different regions of the world as a whole. So we don't want a Chinese vaccine in the United States for this tunnel virus. We don't want an Indian vaccine in this as a United States American vaccine. It has to be a Pacific specialized vaccine for each region of the world for a reason. So we can't just have one vaccine for everybody because it's affecting people on a different level. And you've seen the pictures, it affects people's respiratory illness, it affects their whole breathing system, and it causes shock. It causes shock because it stops you from breathing, it causes shock automatically on your body. And the nursing staff, the whole medical staff have to be covered and PPE garb, personal protective equipment garb, to protect themselves for any kind of getting any viral droplets onto themselves in order to help take care of the patient, the client that's affected by this coronavirus. So this tunnel virus. So guys, please understand the term why it is called a coronavirus. Please understand the term why it's called a coronavirus. It's called a coronavirus because it is a combination of viruses, of big viruses that are now putting into a super big virus as a whole. So it's a combination of SARS, it's a combination, even a little bit of Ebola, it's a combination of, I think, even the chicken swine flu. So it's a combination of these big viruses that have affected people in the past, and we thought we had a vaccine as a whole, but all these big viruses are now turning into a super virus. So that's why they're calling it a coronavirus, because big viruses turning into one super virus. So please understand the term why it is called a coronavirus. Please understand. Don't be fooled thinking about it's about beer. Don't be fooled thinking it's about Mexicans or Asians, hate against Mexicans or hate against Chinese or hate against immigrants. And there is probably people hate because of lack of knowledge. They people are prejudiced because of their lack of knowledge. So people lack of knowledge causes them to be dumb. And when dumb people respond to things in a different way, it lets dumb people actually spread their knowledge into more dumb people. And so the population as a whole becomes dumb to the virus and to this epidemic. And so the whole population, the whole global population, people in different countries, the United States and Europe and China and Japan, become dumb to actually understand what this illness is. And again, I've been in the medical field on a personal experience for 8 to 10 years doing home health care, diabetes management, medication management, behavior reports on the administrative side, as well as the clinical side, as well as the personal home health care side. But I still am a professional, but I'm an entry level professional into this field. So somebody with a surgeon or an immunologist, or even Dr. Ben Carson, or even the president of the Mayo Clinic, or even the president of Boston Medical Hospital, or even the president of Harvard University Hospital, or even the president of Howard University Hospital in Washington, D.C., can actually let their local communities know to respond to this in a different way. So please understand it's a coronavirus for a reason. Please understand the specific term behind the World Health Organization calling it COVID-19 is a coronavirus for a reason, because it is a combination of big viruses going into one super virus. So it's all these big viruses that we thought we had a vaccine for actually going into one big super bug virus that's affecting people all over the world. And we don't know how to respond to this. We know how to respond to symptoms of Ebola. We know how to respond to symptoms of the swine flu. But when symptoms of Ebola and the swine flu and the chicken flu come together, then they make stronger and stronger and stronger. So it attacks a person like that. It breaks down your system and it causes shock. And so when you see the pictures on the internet, just Google coronavirus patient pictures, you'll see the doctors putting out tubes and tubes and tubes into the patient's respiratory tract in order to actually get in there and feed into their bodies, even feed into oxygen, feed into food, feed into fluids, oxygen into their bodies in order to get them to break it up and actually have the person able to breathe. You'll see about it. So again, please understand it's a coronavirus because it is a combination of super viruses and turning into one big superbug virus. So it's a combination of old big viruses we thought were no longer existent anymore. We thought we had a vaccine for, a cure for, actually coming back from the dead and actually turning into one big, resurfacing into one big super virus. And the health community don't know how to respond to that as well. So again, thank you guys for your time. This is LaQueen, Terry Bauer, LaQueen, National Certified Medical Assistant Phlebotomist, graduate of Purdue University, graduate of Purdue University, Indiana, graduate of Harold Washington College, Chicago, and graduate of Northwest Educational Center in Houston, Texas. I love you guys. Please, this is my fifth part of the series. I apologize for my blogs yesterday, but I guys let you know I'm very emotional sometimes. But I have been kicked out of a lot of facilities, not just here in Albany, but Buffalo and Syracuse as well. But it's normal. It may be normal, may not. So anyway, please guys continue to keep me in your thoughts and prayers. I love YouTube. I thank YouTube. I thank you to Albany Public Library as well as to this hotel, the Marriott Express Hotel here in Albany. So as well as the Greyhound. Thank you guys for letting me keep me in your thoughts and prayers. I'm going to continue to go on, continue my struggle, and also further on do more talks in the community. Doing discussions with the Bronx, New York Public Library, doing a community talk there as well. And so I'm applying for jobs and applying for housing as well. And then I'm doing a talk. I try to do it in New Rochelle. I called some pastors in New Rochelle today, but the governor has National Guards down there right now blocking any kind of public access to New Rochelle, as well as any kind of neighborhood, neighborhoods outside, about 5-10 miles outside of Rochelle, even near the Bronx. There are local neighborhood libraries, even near the Bronx, because it's a viral. So it goes like that. So again, I'm just trying to go out the community, in a network with people, researching, always reading, because I'm still a novice. I don't have any professional expertise at all. I haven't published anything, but reading brings knowledge, and reading brings compassion and understanding, and lack of fear is lack of knowledge. So I don't have any kind of fears towards what I'm going through and what the community is going through as a whole. So I'm always looking up the White House news updates, the White House press conferences, USA Today, New York Times. I'm always reading, especially what the World Health Organization is saying every single day, the CDC and the NIH, daily medical reports, because it changes every single day. So I'm always being updated with the WHO, the NIH, and the CDC every single day. So I love you guys. Continue to keep your thoughts and prayers. I got my little, the hotels, as I'm gonna wipe this area, pretty down, and I'm gonna leave. Thank you again to them letting me use their facilities. So please guys, again, understand one more time, the coronavirus has nothing to do with coronavirus or hate against Mexicans or Asians. It's a coronavirus because it is a combination of old big viruses that we thought were no longer existent anymore, turning into one big super virus. So it's a combination of the swine flu. It's a combination of the Ebola pandemic. It's a combination of the chicken flu coming together and turning into this one big superbug virus that, when it comes into contact virally with somebody, it comes to the immune system and it brings shock. It shocks their immune system, and so it doesn't come all of a sudden at a time. It comes in stages. So it shocks people's immune system, and so they're not able to deal with it. Doctors have to wear PPE, protective equipment immediately. So I'm still updating myself every single day. I love you guys. Thank you again to YouTube. Thank you again for letting me use this podcast and this informational system and a platform. I love you guys. Thank you. Keep me in your thoughts and prayers. Peace and much love. Aloha. Bye.